All right, well, did you know you can make veins vanish in 30 seconds without any pain and quickly? I mean, this sounds great. I'm excited. I'm as excited as you must be because you're getting this done after a long time. But we have several guests here. Dr. Anatoly Volkin of San Diego Vascular Center is here with patient Sarah Zeiler, and she's actually going to go through a demo here. And there's another Sarah, Rendo, who's going to be participating and works at the Vascular Center as well. So thanks for coming in.
Thank you very much for having us.
Okay, I saw this, and I was so excited because I want to get this done. And you were talking about how it's quick and it's painless.
Hopefully.
Two very good words.
Well, the best way to do it is to show it, and that's why we're here.
This center, though, is really well known in the area to do a great job. And why do you think people should go to the Vascular Center versus, the spas that always talk about having this ability to do this?
We have a philosophy about promoting health, and it started with veins, and now we do a lot of other things in the center. The treatment is done by board-certified surgeons, and that hopefully will give you a more holistic approach and hopefully give you the best care possible.
Okay, so we'll get into some more of the facts and also, the different kinds of veins. You have spider veins and varicose veins, and talking about the difference. But you also have some pictures of before and after, and this is actually an injection that you do?
Yes.
Okay, and this is something just that's very quick here. Wow. Okay. What a difference. How soon do you see a difference?
It varies, and everything in medicine is a spectrum. And you have people who have the beginning stage of the disease, and you have people who have very advanced disease. And depending on the stage of the disease, treatment may vary, and the appearance may vary, and the time difference obviously happens because everybody is different.
Now, this is a pretty serious case here, but that you see these varicose veins. Now, this would be something that would take over maybe, say, a long lunch break, and you can get this done?
We try. And again, we do sometimes more than one session, depending on the results and how it appears. But the key message for us is to make people aware that it's a problem. And the screening is very simple, and the idea of coming in for a check is paid by most insurances, and the symptoms go away pretty rapidly.
Okay. Now, I think we should get started on the demo. And Sarah, are you nervous about this at all?
No, I trust Dr. Volkin.
Yeah, so her case obviously is a mild one here.
Yes.
But we'll do that because I think the results show up pretty quickly.
Yes, yes.
Okay, and while you're doing that, would you talk kind of about the differences? Because obviously we're seeing varicose veins and spider veins.
Well, there are different veins and different symptoms associated with veins. And with Sarah's case, these are called spider veins. They're quite small, but still they do have some symptoms associated with them. And if left alone, a lot of them will progress. So I'm going to come on this side. And if you can see the veins here, the treatment is very simple. There's a little tiny needle, and we use a sclerosing solution, which gets injected into the vein, and the vein goes away as soon as it's done.
All right, Sarah. This is something you've had for a long time, huh?
Yes, since I was a teenager.
Yeah, so a couple of different injections. Are you excited about not having it anymore?
Absolutely. I'm happier to be looking at you right now, too.
I know. Sometimes it's hard to see needles.
It doesn't hurt, though. I mean, it's...
You're not flinching.
No. It hurts more to get, I think, your finger tapped at the doctor.
I know.
It's painful.
And this is pretty quick. He obviously knows what he's doing there, along with his assistant. So this is something that will show up, and how quickly will you see a change, usually?
Well, we see the vein go away when we do the injection, and it does turn a little bit red and inflamed over the next few days. And sometimes there is a little bruising that happens afterwards for a few weeks, but almost universally they go away within a few weeks. And what we're going to put a little bit of pressure, and she has one more area that we're going to quickly do.
So you're going to switch chairs?
Yeah.
Okay, yeah, so the viewers can see it. And why is it important for people to go get screened for this? What can happen if you don't do anything?
Again, it's a spectrum of disease, and there's different reasons for it. But the problem is very, very, very common. And it affects 1 out of every 4 women and 1 out of every 5 men in the United States. And
Should I hold it?
And it can progress.
Okay.
You can, the initial stages of the disease is very simple like this with spider veins. Some of them have no symptoms. The progression, obviously, to the veins that you see on the screen is dramatic with associated symptoms. You can get wounds from it, ulcers, you can get bloods from them, blood clots from the varicose veins.
Now, this center, it sounds like just a phenomenal place for people to go and get this treatment. You're also offering 25% off. Is that right?
Yes.
We just showed a full screen, and we'll have more information, but this is the regular price. You get 25% off if you want this varicose or spider vein removal.
The important thing
there's
also,
the address and the phone number on screen.
You know, the screening process is just as important, because if there's an underlying problem which is more serious than just the appearance of varicose veins, we should probably address that. And again, if there is an underlying issue, the insurance companies usually pay for the screening and the treatment associated with the varicose veins.
All right, well, we are out of time, and thank you so much for being here. And this is the San Diego Vascular Center. More information is on our website for this. And you have to know that our patient here, Sarah, not one flinch. You're just sitting there going, yeah, I'm just hanging out. So very nice. Thank you so much for coming in.
Thank you.
And you're going to see a big difference in moments, seconds.
I can't wait.
Go to san diego6.com and click on San Diego.